Mr. Harding, thanks for coming today.
Oh, it's a pleasure, sir.
And you would like me to call you Thomas, right?
That's fine.
I
Yes.
see. So, Thomas, before we start, uh, how are you feeling about having this conversation today?
I think it's a good idea. If it helps someone, just yes, that's it really.
Yeah, absolutely correct. And let's start your story, right?
Yes.
And I would like you to say it in your own words, right? So, when we started the screening program, right? So, tell me a little bit more. How did it all started?
It started after had my heart bypass.
And when was that?
Uh, 2000 and, 2008.
2008. Okay.
Yes.
And so you had your heart bypass,
Yes.
and then how did the screening came into picture
Well,
when you
that
had
came
this?
out of the blue,
Mm-hmm.
and just a shock really. And then I was asked if I'd like to take part in that what you call a poo test.
That's still just.
So I said, certainly, if it's find something out quick before, with my heart and everything. And I did that for, I don't know, 8 years or something like that.
I see. So you were having it every 2 years?
No, it's like once a year. I think it'd be like once a year.
I see. Was it your first screening stool test that you had, or you have had few before that as well?
No, that's when I started doing it.
I see.
And then that lasted for 6 years or something.
Mm-hmm.
And then they wrote back to me that they'd found an anomaly. That was the terminology.
I see.
So I did another one, sent it in. Then they asked me to go in to have some tests and stuff.
I see.
And they found a cancer.
I see.
So then booked me in, had the operation. They did it. They got it early, thanks to the testing.
Excellent.
Otherwise, I would not have known about it for however long.
Mm-hmm.
And then that was it. Was on remission for, I think that's what they call it, 5 years. And I came off Christmas just gone. That was me 5 years.
I see.
But if I hadn't have done those tests, I wouldn't have known, because they only found it through a microscope. So there's no way of you knowing it yourself.
So you were not getting any symptoms, you were feeling just normal in yourself?
Normal in myself, fine, no problems, just champion.
Fine. I believe so that's the purpose of the screening.
Yes.
To pick up the things early as possible, and even at times when you are not having any symptoms, you're feeling just normal in yourself.
Yes.
I see. So that makes it more important, isn't it? And at the time, were you on your own, or have you had a support around?
No, I was on my own.
You were living on your own.
Yes.
And during the process, from the time they picked some anomaly, and then I believe you went for a test, a camera test thereafter.
Yes.
And then have you had a treatment?
Yes, I had the operation.
Operation.
I had a section taken out.
I see.
Went for some more scans and stuff, and this, that, and the other. Mrs. Gaunt, is it Gaunt?
Mm-hmm.
Was the lady who did the operation. Then the powers to be, the committee of surgeons and stuff, they look at everything. And they said they got no more worries. They'd got it all. I didn't need any more chemo or radium, whichever one it is.
I see.
So I had none of that.
I see.
And then that was it.
Good. And during the stages of you having initially the poo test positive, and then thereafter you having a camera, and then followed by the surgery, how was the communication with the hospital and the support system provided to you? How was your experience?
Oh, it was brilliant. I mean, they've been brilliant all the way through. The colon rec nurses, they've been amazing. Because I get the phone calls a couple of times a year off them, just talking about myself, how I am in myself, how I'm feeling, how everything's working right, and all this, that, and the other. No, they've been really, really good, really on the ball. I think I had two 2 scans a year, just keep your eye on everything, and it all come back fine. My blood markers were up a little bit, but they've always been a little bit higher than what bump. But we've sort of got used to that. That's it.
I see.
There's nothing. They can't find any problems.
Yeah. I see. If I may, if we go back a bit, the day you were given the diagnosis that this is a cancer.
Yes.
Take me through how did you receive this? Obviously, it's a bad news, when you hear about the cancer. What was going through your mind at the time?
I don't know. But probably, there is that worry all the time. But having gone through my bypass thing, which come out of the blue, and I got over that, I'm thinking, well, they did that for me, and they didn't know about that until it stopped me dead in my tracks. Pardon the pun, dead in my tracks. But this is different. They've got this right at the very beginning, so it's just a positive outlook,
True.
And then, yeah.
And I get all the positive vibe, and I think when you look back to the whole journey, the process, what do looking at it now, when you look at things backwards, in a retrospective, you feel certain things which were very good, certain things which may have been done differently. What do you think of all this, or the impact on you, the overall impact of the entire journey?
No, I don't think anything. I can't fault anything that was done. I just, the nurses, it just, Mrs. Gord, they just, I don't know, you were there.
I see.
Just came, talked to me, Mrs. Gord, come to see me, talk to me, reassured me, we've got it all, we've got it quick. And I'm thinking, yes, it.
And during the journey, I believe the different healthcare providers would have been in touch with yourself. That includes hospital, probably your GP as well.
Yes.
And can you think of anything which stands a bit different, which you can, okay, well, this is what helped me the most, this is what, when you look at the journey and you feel like, okay, something comes to mind, okay, this was very, a good support at the time, this helped me sail through the journey. Anything else? It can be family, it can be the doctors, it can be the healthcare professionals, or it can be a combination of all.
Yeah. I think it's the whole, Dr. Hussein, the nursing specialists, like I say, they call me like a couple of times a year, have a conversation with me. And if I do have a mither or something's not going quite right,
I see.
The phone number's there. Just all I have to do is call them. If they can't answer the phone, you just leave the message on the phone, and then they ring you back.
I see.
But I never had to do that.
I see.
But it's knowing that they're there, all the time. That's the most important thing, because they know what they're talking about.
True. True. And that can be a reassuring thing, isn't it? Would it be fair to say that during this journey of yours, you didn't feel alone? There were people there to support you. You were not alone in this journey.
Oh, definitely. A good network.
And now reflecting on the screening program, is there anything you think would have been done differently, or you were happy with the whole process?
No, I was really happy. I mean, they wrote back to me and said this anomaly turned out. They'd like me to go in for colonoscopy. Is that it? So I went down. That was like, within, a week or so of sending it off. Went in, had that done, and then you bat an eyelid, and I was in for the operation. There was no hanging about and wondering, oh dear me, it was all done. So that takes, what do you like, you're not worried and minded. It's just like straight through out the other end.
I see.
And then the good news was like, we've got it all. You don't need anything else. We'll keep an eye on you for 5 years.
Excellent.
Everything was going well. If you have a few ifs, like, things won't work quite right for a little while. Then they will get back to normal. You know, a couple of weeks back to normal. And I'm thinking, yeah, done it.
And here we are today.
And here we are today, yes.
Excellent.
I got, like I say, I signed off Christmas for my 5 years.
I see.
But the nurses said, would you like to continue having a blood test?
Mm-hmm.
Why not?
For the monitoring purposes, I see.
Every 6 months. I said, again, sign me up. I'll do it. You know, don't want to wait. Because I've said to the girls, the nurses out there, you don't know if it's hiding somewhere, you know. And if it is, I want to know about it, so I'll go for the blood test. So I go, Christmas I was discharged, I go in June, and every 6 months I'll have a blood test. And if anything shows up, it's there.
I see. So what I'm getting is the screening program. It is a process. It has stages.
Yes.
But I believe majority of the patients who go through the screening program, it's quite short for them. Am I correct? It's just a stool sample, which nowadays they receive by post.
Yes.
And all they need to do is, it has simple instructions on it, whereby they do it, and off it goes.
That's it.
And majority of the patients, right, they come back with reassurance it's negative, and that's the end of the screening program for them. Whereas where they pick up abnormal things, and then it may extend, but that's certainly reassuring and rewarding, I believe.
Yes.
Because we're picking up early, and it can make a massive difference to the patient and the family, right?
Yes.
So because you also have different, you had extended your screening program, started with the stool sample. It came back as abnormal, meaning it showed there was some blood in the poo.
Yes.
Which cannot be seen probably with the naked eye.
No, that's true.
And once that was confirmed, then it goes on to the second stage, but only for those where the stool sample is abnormal. And then second stage, as you mentioned, is the camera test.
Yes.
And thereafter, if it picks up a cancer, because the camera test is one which will confirm whether there's a cancer or not. Mm-hmm. Am I correct?
Yes.
And it's just for our viewers as well, so they know, what is there to expect on each stage. And once, if it's getting picked the cancer, then that starts the next stage of treatment. But what we can probably, as you mentioned, the reassuring what you, as per your experience and the other colleague prior to yourself, is there's a support available to the person, to the family, and you are not alone in the journey.
No.
Am I correct?
No, you're not alone. No, I wish I could remember the nurse, the chap. He was the nursing specialist. We went down and spoke, talked with him, and he taught me all the way. I just never felt on my own. There was everywhere you turned, there was someone there to explain what was next.
I see.
What was next?
Which is reassuring.
What was next? So you're not thinking, oh, what's going to happen next? You knew, you know.
And Thomas, you not only had one health scare; it was two. You had your cardiac bypass, and then there was the bowel cancer.
Yes.
And has these experiences changed your outlook towards how you look at your health in general, in terms of?
Oh, I think my heart really did. Really, when I finished that, I signed up for the rehab gym.
Mm-hmm.
And he gave me a food chart with foods on.
I see.
Different ways to, like, just to say simple potato.
I see.
How to do it good, not so good, bad, very bad, all things like that. And you do start looking at the back of things, That's got a lot of salt in it.
So it has made you
aware
of your health.
Yes.
If you do develop symptoms, you do seek help about it. Is that?
Oh, yes.
And you eat healthy, you look after your health better, right? Excellent. And our viewers, particularly towards, mostly we are based in Stoke-on-Trent, and for the wider community who are watching this podcast today and hearing, hearing yourself, your story, what would your message be to those viewers with regards to the screening?
Do it. if you've got a chance of a screening or a test of something, don't wait until it's obvious.
Mm-hmm.
Because if you can catch it first, you're giving yourself a much better chance, far better chance, and probably saving yourself a lot of heartache and worry.
I see.
Really, just yes, definitely,
Good.
definitely. Anyone, do it. Don't be frightened. Oh, I don't want to know, because that it won't go away if it's there.
Mm-hmm. True.
It won't go away, and do it. I just really, really. Oh yes.
Good. Thank you. Thank you very much. And finally, really appreciate you coming here and telling us your story. What does it mean to yourself to share your experiences with others, about the bowel cancer and the screening?
Well, I just feel lucky that I did it and it was done so early.
Mm-hmm.
And if I can encourage someone else to do it, and touch wood, that it'll never happen to them. But if it does, if they get it at the beginning, your chances are brilliant. Rather than wait and wait and wait, and then you've got, you don't want to do that to yourself.
True.
Go and find out. Go if you've got a chance to do a test for something, go and do it.
True.
Really, please go and do it.